I'm going to go ahead and introduce myself. I'm Dr. Lynette Menezes, and I am the Assistant Vice President for International for USF Health, which consists of the Colleges of Medicine, Nursing, Public Health, and Pharmacy, and also the School of Physical Therapy and Biomedical Sciences, and those two come under the College of Medicine. I'm also the Assistant Dean for International for the College of Medicine, and my faculty appointment is with the Division of Infectious Diseases, and I'm an associate professor there. My colleague, Dr. Oxner, will be there for most of the meeting to kind of moderate with Dr. Chatchanan and Dr. Tanat here. But I just wanted to welcome each and every one of you. This is probably our third or fourth student conversation series that we have started. We started them with UNAM, which is the National University in Mexico and located at Mexico City. And we've also worked with one of our partner institutions in Barranquilla in Colombia. So I think this is our third institution. Jesse, who's our director for our international programs here at USF Health, and he will, I think, is this our third university that we are working with, Jesse?
This
A
is
student
actually
conversation.
It's our fourth university.
Oh, we have Exeter also, right?
Mm-hmm. Yes.
Right. And then I have Tina, who is also our travel coordinator, as well as manages all of our programs in USF Health International. And Jamie Smith, who's our observership coordinator, clinical observership. So I know at some point we've had Chula students who've also come in and rotated with us. So we might see some of you in the future as well. So you're always welcome. So Jamie also manages some of our programs here at the College of Medicine for International. With that, I'm going to have, I think, do you want to introduce our students? Or I think Dr. Tanat and Dr. Chatchanan, maybe you can start with your introductions and then the students can introduce themselves. So welcome everybody. We are very, very excited to have all of you here. For our students, it's very early in the morning. But for all of you, I know it's going after hours, and I truly appreciate that all of you have gotten together. And this is going to be a great way for each of us to network and learn a little bit more about all the healthcare, whether it's COVID related or vaccine. I know you have a special topic this morning, but in general, it will just be great for us to know a little bit more about what each of us does in our own countries in different ways and learn from each other. So I'm looking forward for this first half hour to learn from all of you. And I know Dr. Oxner is going to join soon because she's in clinic. She's a clinician. So she had to take care of some patients and then she'll join us soon. So with that, I'm going to have Dr. Chatchanan and Dr. Tanat take over. Thank you.
Hi everyone again. My name is Chatchanan. Can you hear me? Right. Okay. Yeah. I am just starting like a faculty position here in Thailand in Chulalongkorn University, of course. And I just recently got my PhD around like less than half a year ago, and my PhD was is in molecular biology, so it has nothing to do with COVID or anything. So yeah, I am very, very excited to learn from all of you today. Yeah, so I'm very, yeah, kind of nervous a little bit, and yeah, as you can see that, yeah, I'm super excited to learn to what am I gonna say? Yeah, and like because the situation in the US and in Thailand are quite different. We have something in common, but culturally and geographically, well, I mean, look at the size of the country, right? Yeah, there's something that I am very, very sure we can learn from you, and maybe something that could trigger some thought that maybe could be useful for the US side as well. And and I would like to transfer this to Dr. Tanat. He's going to introduce himself, and then maybe I think we're going to go around the table and kind of introduce ourselves before Dr. Tanat will before he is going to present kind of a summary of the situation in Thailand
Perfect.
right now.
My name is Tanat. I am a lecturer of the clinical anatomy, and I am the advisor of the international affairs of the student affairs in Chulalongkorn University. Like Dr. Chatchanan, I am not the expert in COVID or in vaccination. I am actually am the radiologist, but I can provide some knowledge about the COVID vaccine and some situation in Thailand, and I can give some information to share and to exchange the experience between us and our students to share their knowledge.
And now I would like us to start going around the table, and who would like to go first?
I think maybe the Chulalongkorn students, do you all want to introduce yourself first?
Yes.
Sure. Please go ahead.
My name is Palita Rodanan, and I am the fourth year medical student at Chulalongkorn University. And I am the president of the International Affairs Club here. And nice to meet you all.
Nice to meet you and welcome.
All right. Good evening, everyone from Thailand. So my name is Buvit. You can call me Park. I'm currently also a fourth year medical student here in Chulalongkorn, and I am currently serving as a vice president of MDCU, or Faculty of Medicine Chulalongkorn, vice president for international affairs. I hope I'm looking forward for a fruitful discussion about COVID-19, which even though each countries are pretty different, but we are currently going through like the same pandemic. So I hope we can share the perspective both on whether the similarities and the differences between the two countries. So I really I'm looking forward to that discussion, and nice to meet you all.
Thank you. Welcome. I see. Farside, do you want to introduce yourself? I think you'll have to unmute. Yes.
I already unmuted. Hello, can you hear me?
Yes.
Okay. Hi, my name is Fasai Bang, but you can call me Best. I'm the first year medical student in Chulalongkorn University, and nice to meet all of you.
Welcome. Palita?
Oh, I have introduced myself.
How about Yanis? Could you go next, please? Oh, Titipan, yes, you could go ahead.
Hi, my name is Thitipa Bangphongpan, but you can call me Sheng Sheng. I'm a second year student at Chulalongkorn University and a representative for this activity. Nice to meet you all, and I'm really excited and also a little nervous for our activity.
Welcome. Who else? I see. Who else is? I think we have some more students, right?
All right, so I will go first then. Okay, so greetings everyone. I am Baramir Samta, but please just call me Om, okay? OHM. Yeah, it's my nickname. Currently, I'm a second year medical student here, and yeah, it's nice to see you guys here. Yeah, and I'm sure that we will have a good conversation.
Welcome.
Hi, my name is Yanisa, but you can call me Sa. I'm a first year medical student at Chulalongkorn University. It's really nice to meet you all.
Welcome.
And hi, my name is Kina Prapatang Prapkiat, and my nickname is Matmi. I'm a third year student studying in Chulalongkorn Memorial Hospital here, and I'm really looking forward to exchanging ideas and situations with you guys.
Wonderful. I think we have introductions from all the Chula. I'm going to shorten Chulalongkorn to Chula. folks. So I'm going to just quickly introduce Dr. Oxner. Dr. Asa Oxner has just joined us. She is the vice chair for our Department of Internal Medicine and also an associate professor in the Division of Internal Medicine. Dr. Oxner has many years of experience working globally, and she along with her husband, Dr. Andrew Myers, had gone to Sierra Leone during the Ebola epidemic and has treated patients there and spent another whole year after that building the healthcare system. So she helps in leading some of our international efforts as well. She has been to Thailand and taught there as well. So we're excited to have her here, and she will be spending the next hour with all of you and talking, part of this whole conversation and moderating it. So I think with that, we'll go ahead and have Dr. Oxner, you want to wave? And then with that, we'll have the students introduce themselves. Our students, I can see Matt and Sharon and everybody here.
Sure, I could take the lead. So good morning, everyone. My name is Matthew Udine. I'm a first-year medical student at University of South Florida, Morsani College of Medicine. And I'm really excited to have a conversation with you guys.
Hi, everyone.
Go ahead.
Okay. Hi, my name is Sharon. I'm also a first-year medical student here, and I'm part of the International Medicine concentration program with a couple other students, and it's nice to see everyone here.
Good morning, everyone. My name is Donia Milani. I'm a first-year medical student at USF as well, and I'm also in the same International Medicine scholarly concentration. And I'm really excited to meet all of you and have this conversation today.
Chris?
Good morning, everyone. My name is Chris Centarlis, not Valentine Centarlis, in case you're looking at the screen. I'm a first-year medical student at the University of South Florida as well. And we often use Microsoft Teams rather than Zoom. So somehow I ended up getting logged in on my wife's account. So I apologize for that, but my name is Chris Centarlis, and I am also looking forward to having this conversation with you guys.
Thank you. I think we have Arthur and Jake here. Arthur?
Hello, Dr. Menezes.
Hi.
Hi, everyone. My name is Arthur Zakarian. I'm a first-year medical student at the University of South Florida, Morsani College of Medicine as well. And I, too, look forward to the conversation we're going to have today.
And I think we have Jake. Jake, we don't see you. I think you have to unmute yourself.
Sorry about that. Good morning. My name is Jacob Albers. I'm also a first-year medical student at USF. I'm already enjoying the conversation. I think I'm always super impressed when I interact with international students because your English is more articulate than mine sometimes. So I'm very much looking forward to this conversation.
Wonderful. So I think with that, Dr. Tanat, you wanted to begin, and then I think Dr. Oxner is here as well. So welcome everyone, all of it again, but this is going to be great.
Okay, let me share the screen.
Dr. Lynette, could you please let us share the screen, please? Could you please?
I think, Jamie, are you who's?
Yes, let me work on that.
Oh, sorry.
Give me 1 second. Okay, you should be able to share.
The situation about the COVID-19 in Thailand. I would say the brief situation and some details I will let the student to discussing in the next session. As everyone knows that the COVID-19 began in Wuhan, China in December 2019, and the first case that infection in outside China was detected in Thailand on January 13, 2020. She was a Chinese female traveler from China, which support the fact that the traveling that helps the spreading of the disease. And this is you can see the graphs here. The one on the left is the accumulated cases from February 15, 2020 to April 13, 2020. And you can see the significant increase in number of the reported cases around late March. If you see the graph on the right side, which show the daily new cases from the same time period, you can see the spike of the 188 new cases on March 22nd, 2020, which I believe that it is the same trend worldwide. And the government declared the state of emergency and lockdown from March 26, 2020, and the curfew went into effect on April the 3rd, 2020. Everyone flying in from abroad must be quarantined for 14 days and get nasal swab twice. And as a result from the policy, the rate of new cases gradually dropped throughout April, and by mid-May 2020, the stepwise government measurements, some enterprises and activities are allowed to reopen after that. However, during that time, the authorities encourage people to wear masks and wash their hands often and practice social distancing. For the cultural reason, everyone complies the policy. If you walk down on the street in Bangkok, even now you will see everyone wear masks. You can see that at this point, we had been living with 0 new cases for a while. Until a couple months ago, we have what we had called a second wave emerging in an urban area of Bangkok. The cluster of outbreak was identified as in the seafood market that supplied the whole country. And the second cluster was found not long after that in the Rayong provinces. And that is the situation we have right now. About the vaccine, the Thai government ordered vaccine from 2 manufacturers, the Sinovac from China, which is an inactivated vaccine, and the other one is from AstraZeneca, which is a recombinant adenoviral vector. This company also signed the bilateral deal with the local biopharmaceutical company to produce and distribute vaccine for the Southeast Asian countries. The plan for vaccine distribution, first of all, there are 65 million people in Thailand. Around February, we have total of 50,000 doses from AstraZeneca and 200,000 doses from Sinovac. As you can see that by May, even with the total accumulated around 27 million doses, just only approximately 40% of population is vaccinated. This is the best case scenario when everything goes as planned. And this is the photo of when the Thailand receives first doses of Sinovac, the first batch of the corona vaccine from China. And in this picture, the public health minister received the shot of Sinovac vaccine, and later the prime minister receives AstraZeneca vaccine. You can see that they are very happy to get the vaccine. As the authority planned, the frontline healthcare provider and at-risk group are the first priority to get the vaccine. The vaccine priorities also go to the province where cluster emerged. The vaccine is distributed in 22 provinces. The 6 provinces where cluster have been reported recently, 8 tourist provinces and 8 border provinces. This would be the summarize of the general situation in Thailand, and we may start the discussion now.
Do we want Dr. Oxner to also present and then we start from?
Yes. Sure. So I do not have a PowerPoint, but I can talk through some of what we're doing over here. We have also, well, we have much higher cases, which everybody knows from the news that, you know, are public health measures in terms of wearing masks have not been promoted for the whole year. They're being promoted now, but that hadn't been the case. And so because of that, our numbers of cases per day are higher. And so, you know, overall that part is, you know, different. And I think that is contributing a lot to the cost of COVID in the United States. And then for the vaccines, we have, it's very interesting because the main supply of vaccine companies that is supplying us is entirely different. So you guys have Sinovac and AstraZeneca, and we have Pfizer, Moderna, and Johnson & Johnson. So like just totally separate. The Pfizer and Moderna ones are the mRNA vaccines. And then the Johnson & Johnson is also an adenovirus vector, like the AstraZeneca one. And for, you know, our first doses, which started around December, mid to late December, it was also healthcare workers first, and then second was elderly patients. And then now almost every week, they're like lowering the age so that more and more people can qualify for vaccination. President Biden, you guys probably saw that he said by May 1st, anybody who wants to get the vaccine will be able to get the vaccine. And so for the state of Florida, where we are right now, it is people aged 50 and above, or if they're under age 50, but they have any kind of chronic illness or socioeconomic vulnerability, like if they are homeless or if they live in group housing, or, you know, something like that, then they qualify. And supposedly in Florida by April 12th, they're going to lower the age to age 16 and up. So then it'll be all adults will be able to get it. That's what they're saying. So that's kind of like where we are, the supply that we have, and kind of what we're doing. So I have a question for Dr. Tanat. My first question is, how did you guys set up the vaccine centers? Is it at universities, at hospitals, or is it at stadiums, or like where do people go to get vaccinated?
So I think I'm going to answer this question for now. Yeah, I am not entirely sure of how we set up like the center of distribution, because we are such a small country. So everything can just fly directly from Bangkok and could just get there in like a very, very short time. Yeah, and And I think the second thing that could be very different than in the US is that the type of the vaccine that we have here is very stable in like a high temperature. So it doesn't need like the minus something, minus 180, 70,
70
yes,
degree.
degree facility, like a large, incredibly large facility for all of that. Yes, so my answer would be, yeah, it would be we just get everything from Bangkok, and then it could go to directly to the hospital, and it could just get stored anywhere because we don't have that many doses right now anyway. Yes, it's very small number of the vaccine we have here, and probably right now everyone in your university, in the School of Medicine, probably you probably all get vaccinated, right? If I understand correctly, because because I do have some friends. So, yes, Dr. Oxner, what are you saying?
Yes, so for now, anybody who is a professor, like a teacher, is allowed to get vaccinated. Obviously, anybody who's in healthcare has been able to be vaccinated. And then the students, we are working through the list of them because that's the one that has the very longest list. So we have all of them, and they are coming through, but I don't know if they've all been fully vaccinated yet. All of you guys who are on, have you guys gotten yours?
No, we just got the survey, came in yesterday actually. Yes, yeah, we were just talking about this yesterday as this survey came in, and we do know someone who got the very first doses of the vaccination, but it's probably like only 100 people, something somewhere around that number. Yes, not many people at all right now. Yes, and we. I'm not sure about how many we're going to get in the future as well, because we do actually, well, the original plan with the government is that we have this plant, it's called Siam, Bioscience. Yes, to be a plant of the AstraZeneca type of vaccine manufacturing and distribution. It will be a center for the whole Southeast Asia. But then I don't know what happened, that plan got kind of slowed down a little bit. So yeah, we haven't heard about that distribution or manufacturing plan as of now. But so mostly right now we have been relying on importing all those vaccines to Thailand. But I think one of the students would know better than me because they have done quite some research on that. So who would like to volunteer to help me on this topic?
I have some information on the vaccination distribution in Thailand. And I want to explain about the how the vaccine is distributed to to many areas in Thailand. And first of all, we have two types of vaccines now. Is the Sinovac and AstraZeneca. And I have some update information because today is the first day that Johnson & Johnson have been approved in Thailand by the Administration of Food and Drugs here. And so we haven't got our own R&D, and so we have to like depend on the imports, right? So we divided into two phases of the distribution. Now is the first phase, which is the goal is for health and not the economics. By reduce the morbidity and mortality rate and severity of the disease. The target population and the high-risk area have been focused. The people in the high-risk area who have the high risk of infected the COVID-19 will be the first group who have been vaccinated. The target population is the first medical personnel, the frontline workers, both for the public and private segments. And the second is the people with underlying disease, such as the severe chronic pulmonary disease, cardiovascular disease, or chronic kidney disease, and so on. And the third one is people who age older than 60 years old. And the last group is people who works at the high-risk COVID-19 patients contact. And for now, the government start to vaccinate the people who have just lived in the high-risk areas in the province and in the district, the high-risk district in Bangkok. And my friends just got a shot today. And in the in the medical school, there have been the staff and the nurse who have got the shots here, but still don't. I still don't have the shot now because we are medical students. And I want to state that there are some problems for vaccinated in the medical schools, because in the medical schools is the non-health minister affiliated hospitals. And so because of that, we are lack of recording and side effect reporting system that affiliated with the central government. So it is a bit delay here in the medical school than the local hospital. Okay, and that's all.
Great. Well,
Anyone want to add something to this?
Just to give a little perspective on what we're going through here in medical school. So I believe Dr. Zweigart, who is the head of medical affairs at USF, just sent out an email last week saying that they're starting to work to get us the vaccine. So I think we as first years, I believe there's only first years in this conversation, are planning on getting the vaccine, I believe, within the next few weeks.
Oh, that's great.
So that's exciting.
Yeah, we started with the students who are in their clinical years, like third year and fourth year, where they're seeing patients. We started with them months ago, but we had to do like medical students, nursing students, pharmacy students, physical therapy, all that. And then once we finally finished them, then we could go to the younger students. And after we finish these guys that are on the call, then we'll go to the undergrad students, which there's like 50,000 of them. So that's going to take a long time. But we hope that we'll be there by the summer so that for the fall semester, everybody would be vaccinated. Is Sinovac 2 doses?
Yes.
2 doses.
Okay. And AstraZeneca is 2 doses, but in the UK, they're doing 1 dose, right? Are you guys doing 1 or 2?
I'm not really sure about that. Is there anyone who already got the AstraZeneca vaccine in our country? Is there any? What about the minister? Yeah, who could help me on this? Yeah, so if I have to answer from what I understand is that we're going to stick with the 2 doses, but because we don't really, not too many people got vaccinated, and if I understand correctly, it was the ministers and yes, the group of politicians who got the AstraZeneca vaccine.
The older patient will have the priorities to get the AstraZeneca, especially the people who age over 59 we got the AstraZeneca, but the younger people will get the Sinovac.
Okay.
It's a policy in Thailand.
Okay.
I haven't heard anything of splitting the doses or something like that. I did heard.
And I think it's. Oh, I'm sorry.
that you're going to use the second dose of someone else to at least try to get everyone their first dosage, and then you think about the second dosage later. But I'm wondering if there's some kind of research, or is there any recommendation on the efficacy, or like in terms of the benefit overall came out already on this?
Yeah, I don't know for AstraZeneca because I didn't read up on it because it's not getting imported to us over here. But I know for Pfizer, if you get just one dose, it's about 52% protective. If you get two doses, it's 95. And for Moderna, if you get one dose, it's about 70%, and then two doses is 95. So for the very beginning, like the first week, the governor of Florida said, oh, we're just going to do one dose. And then everybody freaked out. And so he changed his mind. He said, okay, fine, we'll do two doses. But that was like.
Makes a lot of sense.
So I had a question if someone from Chula could maybe take a shot, or if Dr. Oxner wanted to give an answer. So have you guys seen any hesitancy in people wanting to take the vaccine? Because I know in the US especially, there's some people that don't have trust in the vaccine. And I was wondering if that was an international trend.
Yeah, it is. In Thailand, there people hesitates for get a vaccine because firstly, the main reason is about the safety of the vaccine, and second is about the efficacy, that they haven't tried the Sinovac and also AstraZeneca because the Sinovac is still didn't publish the third phase of the vaccine trial. And so this is a main concern of Thai people here. And about the social and culture, let Matmi and Om speak, please.
All right, so I will start first then. So talking about social and cultural aspects of the vaccine, we are quite lucky here that we have like very few number of anti-vaxxers here. Yeah, so like it's a good thing that there's almost no movement against such vaccines. Yeah, in the form of any like demonstrations or something like that. But yeah, there are still some sort of trust issues, as Alita have already said, about the efficacy and the safety of such vaccines. But there is still a huge issue about fake news here. Yeah, in all forms of social media, like all forms possible. As you can think of, like Facebook, Twitter, Instagram, and so on. Is the main way to spread such fake information to the audience across the nation. Yeah, and it's stemmed from the fact that many Thai people really don't bother check the check the facts first before like sharing such information to their loved ones. To exemplify such fake news to you guys here. So there's a news saying that standing in direct sunlight can eradicate the coronavirus. And the vaccines are actually the coronavirus itself. And lastly, vaccines from Chinese companies are so ineffective that not using it will still give you a higher chance of survival against the virus. Yeah, something like that. But luckily, we have an organization called ANFC Thailand, or Anti-Fake News Center of Thailand, which provides us with more credible information and also myth debunks in several topics, including COVID-19 as well. The organization is established, let me think. Yeah, it is a ministry. Maybe it is organized by the Ministry of Digital Economy and Society, yeah, of our country. Also, police arrests have been made to like those who spread such news to the public. Okay, and yeah, maybe that's all from me. So I will let Matthew speak.
So to add on the topic of vaccine hesitancy, so there has been a lot of polls surveying the people's perspective towards the receiving of the vaccine. So the result is that the majority of people still want to get vaccinated. However, they are hesitant and want to wait to gain more information regarding the side effects and the efficacy of the vaccine first, because especially the news about AstraZeneca side effects has been like widely spread. Like for example, like some countries in like Norway, for example, there has been people got COVID vaccine and has a lot of side effects, and Thai people that made Thai people a lot of like quite shocked about the COVID-19, like the COVID-19 vaccine. And there has been a lot of reports on the side effect of AstraZeneca, the one we are using in Thailand. For example, like transverse myelitis and also idiopathic thrombocytopenia. So I think a lot of people, most like ordinary people and people in the healthcare sectors, are quite worried about the side effects of this vaccine. So most of them would like to wait first. Yes.
So I actually have a question for anyone who can give me an answer. I was looking at the Worldometer rates for Thailand, and you guys have done really, really well. There's only been apparently 92 deaths. And so of the resolved cases, that's around a 0.3% death rate. And in comparison to other countries like the US, that's incredibly low. I couldn't find a single country that had a lower death rate. Even the Diamond Princess, which only had like 750 cases, had a higher death rate than Thailand has. So what measures have been taken to keep the death rate so low? What is Thailand doing?
Right, I think I can respond to this question. That is actually a pretty good question, but I think it stems from the fact that Thailand do pretty extensive like contact tracing, like from the very start, like beginning in the first cases in January, we already started contact tracing since then, because I think Thailand has like a history of like sort of like SARS, which is an upper respiratory tract virus as well, like a couple of years ago. So we have sort of like an experience of how to deal with this sort of problem. So I think the contact tracing are sort of like established in Thailand prior to the COVID-19. So we do contact tracing from the start, and doing contact tracing makes us help lots of asymptomatic cases or symptomatic cases with very mild symptoms before they are actually spreading into the community. So by detecting like these asymptomatic people, and especially like in younger population, we can actually stop the spread. And as these cases are mainly asymptomatic or only minor symptoms, it results in like lower death rates at the end, because the people who are infected are mainly like younger population as opposed to like people who are older population with like chronic illnesses. So I think that is probably one of the reasons.
Thank you. You have to take some notes.
I wanted to think. Oh, sorry. Xing
okay.
first. Xing first.
Well, I like to add, since you were asking about the mortality rate, I think that it's because of the low infection rates too, and it allows us to use resources more efficiently and we're less packed up in hospitals, so everyone can get the best care. Also, we have rapidly developed and frequently updated national clinical practice guidelines, and which are often shared through trusted social media sources. Although this is just from my perspective, and I'm sorry that it doesn't really explain why the rate might be better in some countries with similar infection rates. That's all you
There
can
is something
contribute.
I want to add on is because I think that our culture is different, and here in Thailand we don't do hug or kissing or shaking hands, and this is kind of like reduce the contact, and it's kind of like reduce the case of COVID-19, I think.
And also in the setting of Thailand, so we are quite used to the wearing mask because former, like in the previous period before we have COVID-19, we faced like an environmental problem of like having PM 2.5 or like air pollution was quite bad for some period of time in Thailand. So a lot of people are used to wearing masks, and I think that helps a lot during in the time of COVID-19.
Definitely.
Well, I want to add on some of the key elements of Thailand's successful response. I think it also consists of our strong cooperation and the rapid response from all divisions in the countries. Because in Thailand here we have what we call village health volunteers. They are also the ordinary people, but they contact with the medical professionals, and they also know more about the vaccine. So in the sub-district level or the community level, they have the supported communication on preventive measures and monitor compliance with communication to inform the small group of public about the risk of COVID-19. So in a small group of people, they also receive this information, and so they can act to prevent the COVID-19 risk. So I think the key is the information spreading that in the sub-district level, people also know about this.
Great. Thank you guys so much for answering.
Do any of the Chula students have questions for the USF students?
I was wondering about like the peak of your cases when there was like, I think there was a time that there was like overload of cases like all across the United States, both in like San Francisco and in New York City. How did you exactly deal with that situation with like the ICU overflowing and like there aren't hospital beds enough for COVID patient, let alone like normal patients? So how did you guys get through that stage?
I think I can kind of answer this a little bit. So we've had a couple of peaks in the United States. One, the biggest one, or not the biggest, but the first one was in March and April when kind of it spread the entire world and everyone went on a lockdown. Then we had a huge peak in around July in the middle of summer, and then a big one kind of in the December, January time after the winter break and the holidays. And the big kind of method that we used to deal with this was just kind of let it ride out. There wasn't really a whole lot done except hope that more resources, ventilators, things would be distributed, and just kind of pray because we've had an administration change in the United States in the last couple months recently, and the previous administration didn't handle the situation as well as I think the current administration is doing. And so we had a lot of supply problems. There wasn't a lot of seriousness in the issue, and they weren't trying to make sure that it was done correctly. And so we see in the United States there is a politicization of the way that we distribute and the way we handle cases and everything like that. And there's one party that more has a certain view about the virus and the way it should be handled, and the other party has a completely different view. So we're still battling that out currently, and I think that's caused a lot of problems here.
And just to add on to what Sharon talked about, during the peak, when the ICUs were really overflowing, I know in a lot of the big cities, they were building huge makeshift ICUs and tents all over New York and San Francisco, like you mentioned. So during that peak, when it was really bad, there was a lot of on the fly trying to shift and accommodate all these cases that were coming in. So it was really difficult.
Yeah, to add to that point, I have a few friends in New York City who go to Columbia, and they were literally kicked out of their dorms early because Columbia took their dorms and turned them into basically like hospital rooms so that they would have places for people to go because the hospitals were just so overwhelmed.
And to add to that, we had some hotels in Tampa that we kicked everybody out, and we turned them into recovery hospitals. Like after people were starting to get better, but they couldn't go home quite yet, so they went there instead. And then most states sent doctors and nurses to New York and San Francisco to help because they just have the most people, and everybody's crowded together. So they asked for help from all the other states.
I'd like to ask about after the peak. Like, do you guys have any idea what made the cases go down? Like, was it the work of the healthcare sector or new national policies, or do you think it was just like natural progression?
Well, I think after the third peak, where that was when the vaccine distribution program started to originally get going. So we've seen a pretty steady decline since then as vaccines become more widely available. But in regards to the first and second peak, I think after the first one, people were really shocked at how dangerous this virus could be. And so as it progressively got worse, I think people began to take it a little more seriously. And that led to it to drop down a little bit. And then they got a little more relaxed again over the holidays and led to the second spike. But as vaccines have consistently come out, we've seen a bit of a stabilization.
Thanks, that's a really complete answer.
Actually, I have one more question. Like in the United States, there's like both the federal and the state government, right? And there are responses to COVID, both from the federal and the state. Do you think like both responses, when they sometimes like contradict each other, do you think there poses like a hindrance of like the response as a whole country?
So I actually think that was a huge problem for us because I think a lot of what the former administration did was kind of delegate to the governors of each individual state to decide what they were going to do. And they didn't have travel restrictions between different states. So you had one state that was taking these severe measures and then another state that was being extremely lax, and then people coming to and from those states. So I think that played like a huge role in making it like a little bit more unorganized, since there was originally like a national plan, but it was kind of thrown out the window and not really utilized. If that answers your question.
Yes, it does. Thank you.
Mm-hmm. In addition to what Donia said, there was also a stage early on where we actually had states that were competing for ventilators and bidding against each other for access to ventilators. So I think that was definitely a hindrance.
And just to talk about a little bit about the numbers, I think you guys said that you have about a population of 65 million. We have, I think, around 330 million people in the United States. And your death rate, I think, or total deaths, what Dania said was 922. Ours is at close to 550,000. So quite a bit different in the progression over a course of a year. And it's definitely gone down. in the last few months, but it's still quite high. We see numbers in the thousands per day dying, and over 100,000 people getting infected per day. So definitely our measures are not as effective, and people are not taking it as seriously as I think they should be.
But like, would your response be better for the economic though? Like, you can still have like mainly normal economics activity going in the background, while we basically almost stop like most of the economy here, because like our economy are mainly based on tourism, and we basically stopped like all international tourism for like a year. It basically took a toll on like our economy and our GDP for the entire year.
Yeah, I can jump in on that. I think it's hard to say in terms of the effect on economics versus health, because I forget who was mentioning it, but you mentioned that your first priority was health in Thailand, and then the second priority was going to be economics. Here in the US, because we've had not so much a federal response, but more of a statewide response, you're seeing the effects at the state level. So across the country, our economics may or may not have definitely been affected. But then in states like California and New York, where the priority was the health of the individuals, where you lock down first in order to keep the safety of the individuals, you definitely saw a greater impact on state economics, whereas in a state like Florida, at the expense of potentially the health of some of our elderly population especially, we did not have as much of an economic problem in the state of Florida. But again, it's because we had that state by state response, you see different economic effects, and you have to really weigh what is worth it. Do you want to have a state with better economic recovery, faster economic recovery, or do you want to have a state with a lower mortality rate? And unfortunately, because people are able to travel in between states, regardless of where you lived, we saw pretty similar mortality rates in Florida as compared to New York, as compared to California. But Florida did end up having a better and faster economic recovery.
I want to add too that in the US though, there were like millions of people who lost their jobs and who probably won't regain those jobs for a couple years, who are still unemployed. And on top of that, like it was very stratified the way it affected people. So in the US, like majority of the people who lost their jobs, it was like Hispanic women, Black women, also men, but women were hit really, really hard because there was like this expectation that now that students were being homeschooled, they needed a parent to be home with them, like actually helping out. And so it's been hitting different demographics in different ways.
All right, guys. Well, we're at the end of the hour. Thank you guys so much. It was really exciting to get to talk to you, see your faces. Maybe we'll be able to start traveling again and meet some of you in person. But we are very impressed with how Thailand is doing. So congratulations.
So before we sign off, can we all turn our cameras on so we can do a group picture? All right. And then I think Tina's gonna get a few screenshots. All right.
We good?
There we go. I think we're good.
Great.
Thank you, everyone. Dr. Tanat and Dr. Chatchanan. Did you have any final thoughts?
I want to thank you for inviting us here to this wonderful meeting. Thank you very much.
Very good. Thank you, everyone. This has been an absolutely fantastic conversation. Thank you, Dr. Tatanat, Dr. Chatchanan, and Dr. Oxner for helping to moderate, and Dr. Menezes earlier today. Thank you to all the students who were here. I think this was a very fantastic conversation. where we did learn quite a bit from each other's processes and best practices and the cultural application of those best practices and knowledge. I think that was fantastic. So thank you, everyone. We really appreciate your time.
It was so nice meeting all of you.
Bye.
Bye.
Thank you, everyone.
Thank you.
Thank you all.
Nice to meet you all.